Now, just we'll discuss about SWOT analysis. So, SWOT analysis in technical jargons are strength, weaknesses, opportunities, and threats. So, here I have some technical jargons terms related to SWOT analysis, which is in strength, technical debt reduction, scalable architecture, cloud native infrastructure, artificial powered automations, DevOps practices, continuous integration and continuous deployment, which is CI and CD, data-driven decisions making. So these terms comes under strength of technical jargons. Weaknesses, legacy code base, technical skills gaps which will found by the technical skills, insufficient testing coverage, inadequate monitoring and logging, vulnerabilities in third parties dependencies, in insufficient resources allocations, and having a lack of documentations. So these are the terms which come under weaknesses. Opportunities, in opportunities, just adoption of emerging technologies, for example blockchain, IoT, and etc., integrations with third party APIs and services, expansion into new market or industries, development of new features and product, and having a partnership with others companies or startups, utilization of open sources software, improvement of user experience through UX and UI enhancement, threats, cyber attacks, and data breaches, competition of from rival companies, rapid technology changes and obsolescence, dependencies on third-party vendor and services, regulatory compliances and having the legal issues, talent acquisitions and retention challenges, economics downturns, and budget constraint. Note that this is just an example, and the actual SWOT analysis will try vary depending on the specific organization and its technical context. So now let's towards about medical jargons. In medical jargons is a specialized language which is used for the healthcare professions and having described the symptoms, diagnosis, and treatments, what type of different diagnoses you are mention out, and it is an important effective communication with accurate demonstrations. So in medical jargons I have some common medical jargon words with meanings. First is abdominal distensions, means swelling of the abdomen. Acute means severe and sudden onset. Chronic means long term or ongoing. Differential diagnosis means process of ruling out other possible condition. Hypertension, it means high blood pressure. Hypotension means low blood pressure. Idiopathic means unknown cause. Indicious means gradual or subtitle onset. Lesions means abnormality or damage to tissue. Malignant means cancerous. Metastasis means spread of cancers to other parts of the body. Morbidity, compliances or illness. Mortality means death rate. Neurosis means cell death. Neurologist means related to the nervous system. Oncology means study of cancer. Palliative care means relief from any symptoms. Pathophysiology means the study of changes in the body due to some disease. Prolongis means production of outcomes. So these medical jargons are used for having health care and having professional to communicate accurately and efficiently by confusing to patients and non-medical individuals. So what is MRI? MRI means magnetic resonance imaging. So here I'm just discussing about technical jargons related to MRI means Tesla. Tesla means unit of measurement for magnetic field strength. MRI sequence means specific set of instructions for the MRI machine. There's T1, T2 wave images, different type of MRI image that highlights different tissues properties. spin densities, which is measure the hydrogen number of hydrogen nuclei in the given area. Signal to noise ratio, which is an SNR. It measures the image quality. Artifact, which is error of distortions in the image. Constraint means agent, substance used to enhance image quality. Magnetic fields homogeneity means uniformity of the magnetic field. Radio frequency coil, which is device used to transmit and they receive signals. Regent coil means device used to partially encoded the image. K space, data space where raw MRI data is stored. Reconstructions algorithms means method used to convert raw data into an image. Parallel imaging means technical used to accelerate image acquisitions. Diffusions way image means DWI. Technique used to measure water diffusions. Functional MRI. So fMRI means techniques used to measure brain activity. See, this is the MRI which it is shown in the picture, and it is have different functions. What is the hydrogen count of hydrogens? Having that. How many diffusion of water do you have? What is the measures of brain activities? If you have some problem in your leg or hand and somewhere else, it can be measured through MRI. So these MRI technical jargons are used by the radiologist, radiographer, MRI technicians, and to understand work with MRI machines, but can be confusion to those who are outside the field. So, no, if you are just watching that MRI machine, so you're not able to understand what is good, what are the reasonings and what are the countings in coming up. Only the radiographers and MRI technicians is going to understand about MRI. So, what is Stephen Waite's MRI? So T1 weighted MRI is a type of magnetic resonance imaging sequence that is use a specific set of parameters to highlight certain tissue properties. Here, there are some aspects of T1 weighted MRI are, which is T1 relaxation time. It measures how quickly protons returns to their aligned state after excitations. Spine lattice relaxation. It is a process by which protons release energy and return to their aligned state. Longitudinal relaxation. It is another term for T1 relaxation. T1 weighing means emphasizing difference in T1 relaxation time between tissues. High signal intensity means fat, protein rich tissues, and some pathological tissues appear bright. Low signal intensity means water, CSF, and some pathological tissues appear dark. Gray matter. What is gray matter? Appears gray due to intermediate T1 relaxation time. White matter means appear with due to short T1 relaxation time. Contrast agent means gadoliniums can use to enhance T1 weighting. We will also learn about gadoliniums, what are gadoliniums are, and T1 weighted MRI is commonly used to visualize metonymy, which shows detailed structure and morphology, and detect lesions, which is identify area of abnormal tissue such as tumors or inflammations. And it could be the monitor treatment response also. It can also track changes in lesions over the time. So keep in mind that T1 weight MRI is just one of many MRI sequences, and specific detail may vary depending on the context and applications. So why T2 weighted MRI is used for? T2 weighted MRI is the type of magnetic resource imaging, which is sequence that uses specific set of parameters to highlight certain tissues properties. So here are some aspects of T2 weighted MRI we will discuss about. What is T2 relaxation time? It measures how quickly protons lose phases coherence and return to their random state. Spin and spin relaxation. What is the meaning of spin and spin relaxation? It is a process by which protons interact with each other and having loose phase coherence. Transverse. Transverse relaxations means another term for T2 relaxation. T2 weighing means emphasizes difference in T2 relaxations times between tissues. High signal intensity means water, CSFs, and some pathological tissues appear bright. Lower signal intensity, which is fat, protein, rich tissues, and some pathological tissues appears dark. Fluid sensitive. T2 weight emissions are sensitive to fuel and water consistent. Edema, which appears bright due to increased water content. Cysts and tumors may appear bright due to high water content. What T2 weighing MRI is commonly used to detect edema means identify area of increased fluid or water content. Visualize joint and cartilage, which is highlight cartilage and joint fluids. Categorize, listens, identify cysts, tumors, and other pathological issues. Monitor inflammations which track changes in tissue's water content over time. Remember that T2 weighted MRI is just one of many MRI consequences, and sequences in the specific details may vary depending on the context and application. See, what is continuum contract? Continuum constraint is the type of constraint agent used in the magnetic resonance imaging, which is MRI. It is scans to enhance image quality and highlights specific tissues or structures. Here are some types of key aspects of gadolinium contrast, which we going to discuss about. Paramagnetic properties, which is gadolinium ions, which is also known as GD3+, alter the magnetic properties of nearby hydrogen nuclei, enhancing signals intensity. Shortens T1 relaxation time, which is gadolinium reduces the time it takes for the proton to return to their aligned state, making tissues appear brighter. Increase signals intensity, which is gadolinium enhances the signal in the T1 weighted images, making it easier to visualize certain tissues or structure. Common applications. Gadolinium contrast is used to enhance UV visibility, highlight blood vessels and analogies, visual inflammations and edema, detect liver and kidney lesions. Types of gadolinium agents which have different formulation includes, for example, gladoplinate and divilimune, which is magnavist and having the multi-enhance, it also known as gladoblin dimoglyamine. So these are some different types of gadolinium agents which used in the terms in T2. So there are some different contradictions and the precautions. Gadolinium's contrast is generally safe, but contradictions include severe kidney disease, which also add risk of nephrogenic system fibrosis, and in having the pregnancy lactations, which is unknown effect of fetus or baby. Adverse reactions, which is rare but possible reaction, include allergic reactions, nephronic system fibrosis, it is rare. Other side effects like, for example, headache, nausea, infections, injections, site reactions. So remember that gadolinium's contrast is a valuable tool in MRI imaging, but it is used should always be carefully considered and guided by the healthcare professionals. What is EMR? EMR is the electronic medical record. In electronic and having the EHR also, EHR is the electronic health record, which is EMR that's shared by data across provider. There have some different technical jargons which is used in EMR, which is HL7. See, HL7 means health level 7. It is also described as a standard for exchanging healthcare data between systems. What is FHIR? Fast Healthcare Interoperability Resources means API-based standard for sharing healthcare data. IHE, which is integrating the healthcare enterprises framework for sharing data across healthcare systems. CDA, which is clinical document architecture, which is a standard for structuring clinically documents. CCD, which is continuity of care document. It is a standard for the sharing patient summaries. What is MU? MU is meaningful use in US government programs promoting EMR adoptions. HIE, Health Information Exchange. It is a network for sharing patient data providers. PHR, which is personal health record, patient controlled health informations. By EMR module, which is a software component for managing specific aspects of patient care. For example, how do you schedule and billing it? Clinical discussions and decision support, which is CDS. EMR feature providing real-time guidance for healthcare decisions. Order entry management system, which for EMR module for managing orders and result. So these technical jargons are used by the healthcare professions, IT specialists, and having the vendor to discuss and implement EMR systems, and during different type of and having efficient standardized electronic health data management. So EMR, what is EMR? EMR are the digital version of patient medical charts containing their medical history, diagnosis, medications, test results, and other relevant information. EMRs offers numerous benefits including improved accessibility, which is authorized healthcare providers can access patients' record from anywhere at any time. Enhanced coordination, which is EMRs facilitate seamless communication and coordination among healthcare teams. It also increases efficiency, which is electronic records reduce paperwork and streamline, which is clinical workflows. Better patient care. EMRs provide real-time information which is enabling healthcare and profession to make informed decisions. Reduced error. Electronic records minimize the risk of error due to illegible handwriting or lost paperwork. Advanced analytics means EMRs enable data analysis, helping healthcare organizations improve patient outcomes and having reduced cost. Patient empowerment. See, EMRs provide patient with secure online access to their medical information and having promoting engagement with all the involvements in their care. Security and privacy. EMR ensure confidentiality and integrity and availability of the patient data, which is maintaining by HIPAA compliances. Some common features of EMR include demographic, medical history, medication management, lab results, imaging reports, clinical decision support, order management, meaning and coding of the EMR process. So EMR have become an essential tool in modern healthcare. It also enhanced the patient care, streamlining and the clinical workflows and improving overall healthcare outcomes. So meaningful use of this EMRF, which is